Itchy, watery eyes, runny nose, the sneezing. Yes, it's spring allergy season. It's in full bloom. It's been here for a while. That's why we're talking to Dr. Pramod Kelkar, a board-certified allergy specialist from Allina Health, to talk about why this year seems to be a little worse than the last couple of years. Good morning.
Good morning.
So let's talk the numbers first. Some 50 million Americans suffer from allergies. How do you know that you have allergies from, not say food allergies, but like from the weather?
You know, typical symptoms of allergy are the runny nose, sneezing, nose congestion, drainage onto the back of the throat. Some people even get allergy-induced asthma, and also itchy, watery red eyes.
Yeah, I would say those are common symptoms. I suffer from allergies myself. I have allergies to tree pollen and such like that. What makes this year worse? I know we had a little bit more of a mild winter. Is it better to kind of gradually climb in temperature through the spring, or is it better for everything to hit all at once?
It can happen both ways. Certainly, if the weather is cold for a long time and suddenly then you get a warmer spell, and if the weather stays warm, the pollen counts can suddenly rise, and that can be a surprise factor and the allergies can be high. But also, if the winter is not too cold and we have warmer weather throughout the winter, the pollen counts are going to be pretty high.
Now, obviously, we're still at the edge of flu season and cold season. How do you tell the difference? Because I have a hard time telling, even in March and April and then again in the fall, the difference between a cold and allergies. Is there specific signs?
You know, this is a very common question, and the viewer should know that common cold lasts for about 7 to 10 days.
Okay.
And it will typically have fever, body aches, but the allergies will continue for longer than 10 days, and they will be associated not with fever and not with body ache, but rather just runny nose, sneezing, itchy, watery eyes.
Now, how does someone know if they need more treatment or more help with an allergist than just the simple over-the-counter medicine like Allegra? How do you know you need to take that next step?
Obviously, if you are not feeling better and if you are miserable, I think people know it. and if the medicines are not working, they should certainly seek medical care.
Should you have testing done? I mean, because you can be allergic to a bajillion types of pollen out there. I've never been tested, but I've kind of pick and choose. It's like I think I'm allergic to tree pollen because I get it in the spring, and I think I'm allergic to ragweed because that's typically fall. But does someone need to get tested for specific kinds of pollen?
You know, testing is important if medications are not helping, because based on the testing, we can identify what specific things you are allergic to, and based on that, we can create allergy shot treatments.
What kind of treatments are available? So is it just shots that help, or is there other things you can do?
You know, we have many treatments available now. We have over-the-counter medications like nose sprays, eye drops, allergy pills, and if those don't work, certainly we have allergy shots. We always tell patients that fortunately the research is advanced now, the science is advanced enough that no one should deny themselves the pleasure of outdoors, because as it is, we have short spring and summer and fall in Minnesota. So you want to be able to enjoy the outdoors. And we have lots of treatment options available to help people. As
an allergy specialist for 15 years, what's someone at home thinking, oh my gosh, my allergies are worse than anyone else's? What have you seen as like worst case scenario in terms of the patient walked in, you go, oh boy, here we go?
The worst case scenario would be when patients are not seeking treatment.
Okay.
They are going to continue to feel miserable, and I don't want people to carry the Kleenex boxes in their pockets all over.
Oh, that would be terrible. And you're just sniffing and sneezing the whole time. And the worst I find is the itchy, watery eyes. Is it, for me personally, we're going to get personal here, is it better for me, for itchy, watery eyes, to do more of a nose spray, or should I do an eye drop?
You know, eye drops are obviously more effective for itchy, watery eyes, because they are going to go directly into the area where you need the action. The nose sprays are mostly going to stay in the nose. They might benefit your eyes, but they are not going to be as effective as the eye drops.
Huh. Good to know. I like this. We need a doctor in house all the time. I like this. Doctor, thank you very much for being here. We're out of time. Enjoy the outdoors.
Thank you.
Do you suffer from allergies yourself?
I don't, but anyone can develop allergies at any point in life.
Can they really?
Yes, you can. So I don't know what will happen tomorrow.
Well, then enjoy the outdoors while you can, I guess. Doctor, thank you very much. We appreciate it.